Hello, my name is Annalie Martin, and today I am going to start with the vital signs. So when you're looking at anywhere from 3 to 6 months old, you are going to want to use either the axillary, the rectal, and the range is going to be about 99.5 to 99.9 at that age. At 3 years, that's when you can start adding in the oral or the tympanic, and that average is going to be about 99. At 5 years, you are looking at like 98.6, and that you can also use the rectal, oral, tympanic, or axillary. And then from 7 to 13, it's going to be around 36.6 to 8, and with that you'll use either the oral, axillary, or tympanic. So with the pulse rate and respirations by age for a newborn, it's going to be higher for the pulse, so that's going to be like 110 to 160, and the respirations will be like 30 to 60. And that's for a newborn, and for an infant it's going to be 90 to 60, and the respirations will be 25 to 30. For a toddler, age 1 to 3, you are looking at 80 to 140 for the pulse rate, and the respirations will be 25 to 30. And a preschooler, so it's going to be going, the pulse rate is going to be getting lower as you get older. So for a preschooler, you are looking at 70 to 120, and the respirations will be 20 to 25. School age, you are going to have 60 to 110, and that is going to be 20 to 25 when it comes to respirations. And once you're an adolescent, that's going to be about 50 to 100, and your respirations are going to be 16 to 20, which is very close to what an adult is. So blood pressure, that is, with an infant, I think it's important to know that their systolic is going to be about 65 to 78, and their diastolic is going to be 41 to 52. So their blood pressure is going to be lower than an adult would be, which is opposite of the respiration. So a 1-year-old, you're looking at the systolic being about 83 to 114, and the diastolic being about 33 to 67. When you are 3 years old, it's going to be about 86 to 117, and your for systolic, and your diastolic will be about 47 to 76. Now, as you get older, you're just going to see that number increase until you get to 16, where it's going to be closer to what you would see in an adult, which is the 120/80. Okay, so a few important things to remember with the vital signs when you're taking a temperature. So a newborn does breathe like irregular with that 30 to 60 breaths per minute, and you will have the pauses. So that is something that might startle some, but is actually normal. At 1 year, the breathing that's when it's going to slow to about that 20 to 30 breaths per minute, and your pulse decreases from 120 to 140 in a newborn to about 100 for a 1-year-old. For a toddler, you're going to notice the heart rate decreases and the blood pressure increases. And at the school age, you're going to have the respirations are going to decrease, and the abdominal breathing, it starts to disappear. So the blood pressure increases and the pulse decreases. Now with adolescents, something that you're going to notice is the respirations usually decrease to about 15 to 20 breaths per minute. You're going to have the decreased heart rate and an increased blood pressure. So with the temperature, you're pretty well going to assess as with adults, and always use the least invasive. So the rectal route isn't preferred, but if you do need to use that, so you would want to make sure there was no contraindications, a weak immune system, or you would also want to make sure they don't have any problems with their white blood cells, and that they don't have diarrhea. So with small children, they can be side lying, or they can be like with an infant, you can have them lay supine with their legs flexed. And you're not going to want to insert that probe any more than 1 inch past the anal sphincter, and you are going to want to lubricate the child, and lubricate the probe before you put it in the child, and also you're going to want to make sure that even though they're a child, you're going to want to make sure they have privacy, and that you're doing that. Either make sure that whatever privacy you have available, like a curtain, or that the door is closed, just to make sure that the family and the child are comfortable. So with the pediatric physical assessment, so the child you should always count the respirations for the full minute. So with the infants, you're going to want to count their abdominal movement, and with a 1-year-old, that's when you can start to count the thoracic movement. And and the apical heart rate can change depending on age. So it's at the 3rd and 4th intercostal space, medial to the left midclavicular line, up to age 4. And then it's going to be at the 4th intercostal space at the left midclavicular line in ages 4 to 6. And it's going to be at the 5th intercostal space lateral to the midclavicular line starting at age 7. Another thing is that sinus arrhythmia is a normal finding. And also children under 3, you don't want to take their blood pressure. You don't need to take their blood pressure unless there's a reason that they need their blood pressure taken. And if they have any type of like a history of having blood pressure problems in their family, then you would definitely want to do that. So if they are older than 3, then that's when you'll start doing it yearly. And it is very, very important to use the right size cuff. If you do not use the right size cuff, you will get an inaccurate reading. Okay, so when it comes to height, so in the first 6 months, the height increases by 6 inches, and in 1 year they'll grow by usually 10 to 12 inches. So sometimes you will use a measuring board. So that is pretty self-explanatory. It is, but it isn't. So with that, you will take the measuring board, or you will use you can also use tape, and you will lay the child down. And you'll just want to make sure that their head is flat up against the board. And then you can, if it's like a newborn, then you can pull, not pull, but kind of help them to stretch their foot. And either you'll mark that on the board, or you can mark it with tape and then come back and measure. So you'll want to do that for younger than 24 months and note the length. And the method that is used for that is going to be the head to heel, where you can mark and measure. So now the scale for the stand is that's what you'll use for older children. So you'll just have them stand over at the scale, and there's usually something that you pull up to get their weight. Now if you have an infant, you will want to make sure they don't have a diaper on when you put them on the scale, and make sure to calibrate the scale just to make sure that it is on 0. And then, like I said, removing a diaper will give you the most accurate weight. So in the first 6 months, the birth weight actually doubles, and after 1 year, the birth weight usually triples. So now with the head circumference, I'm going to try to demonstrate that on my doll here. So with the head circumference, it's going to be about 1 to 2 fingers above the eyebrow, and you'll take your measuring tape. This is my handy dandy measuring tape, and then you're going to put it onto the largest prominence of the occiput. So it's you can feel that one usually sticking out in the back. Obviously the child would be laying down. You would want to keep them as comfortable as possible. And that is the normal range for that is normally 33 to 38. So this doll has a very tiny head, but you would just want to get that around there and then mark it right there. Now with the chest, you are going to want to use the nipple as a guide, and you'll just want to put that around and wrap that around the child, trying to make it as comfortable for them as possible and be as gentle with the child as you can. And with that, you will also measure in centimeters, and normal is going to be about 1 to 2 centimeters less than the head. Okay, well, I think I covered everything. If I didn't, I will be making another video, so just to add in anything that I missed, but I did try my best to cover everything. Thank you so much.